Good morning, everyone. Good morning, ladies and gentlemen. As you could see on the screen, I'm president of the BCG Medical Device Group. My task is how to promote medical device industry in Thailand. So you could see from the title, I put it that from lab to market. That is to promote research result in medical device toward markets, which is to me more difficult than doing research, selling product. Let's look at the next slide to make you understand the category or classification of medical devices. You could see the first one is single-use devices like syringe, glove, mask, and so on. And durable or long-life devices like hospital beds, wheelchair, electromechanical X-ray devices, and then reagents and test kits. Now, as a previous speaker mentioned about COVID-19, everyone on the stage must mention about COVID-19. Thailand is doing very well on the left-hand side, top left-hand side, that in terms of health and wellness of medical devices, we are number one in this region in terms of earnings and number of visitors, and then Singapore and Malaysia. And then there are indicators how we did well in the COVID-19. I would like to highlight the infographic on the right-hand side that we rank number 2, second only to Australia on the recovery index according to the global COVID-19 index. But in spite of this, we are, it's very, the hub of wellness and medical device come at the expense of expenditure that you could see, the amount of approximately 25 billion US dollar, and we increase a lot by 2026. And on the third bullet, you could see that we export, the number of export will increase, but on bullet number 4, import also grow, and will increase more than the export by the year 2018. So I think Thailand must do something about promoting local production or manufacturing of medical devices. Now, when we look into the medical device industry of Thailand, we have 600 domestic medical device manufacturers in Thailand. On the table on right-hand side, there are the big guys, the big companies. And we have about, you could see from the pie chart on the left-hand side here, by size 94%, the number of industry that SME, small and medium, about 94%. But the earning go to the large company, 65%. Now, for the domestic devices, we have divided into three areas in digital platform, and on the bottom right, in implant medical supply, dental implant, 3D print model, and then on the left-hand side, mostly a durable product like digital X-ray, CT scanner, hearing aid. Now, what I'm proposing, or our group proposing, is the strategy. There are some missing words on the first slide. Strategy, 5 strategy to promote lab research result toward market. We would like to use government as a market, but somebody say that we should use it as an initial market. The goals is that 30% of government increase medical device procurement from Thai innovation list. I will explain more on Thai innovation list, to 30% of government medical device expense per year. and create social impact about $1 billion within 5 years, and enable sustainable growth of Thai medical device industry. So we have 5 strategies. You could see number 1, if we want to move to promote the local production of medical device, the number 1 is that we must learn what sort of device we should produce, what sort of device we should provide research funding. So we should look into supply-demand database and identify the target products. The second one, then what we need is we need to use government as a market, or you could see initial market. Of course, you could produce medical device and sell directly to anyone in Thailand, but for small and medium enterprise, very difficult for them to compete with the big guys. And number 3, provide incentive to empowering the domestic investment. And number 4 is about human resource and training of the SME. And number 5, we need to establish what we call platform or within platform. This platform is not only in government, but working with private company also. Now, I like to go into detail of each strategy. This is to identify supply, demand, and also identify the target products. In the table there, this is our team analyzed from the imported product. What are the main import products and the value of the import product year by year. And on the right-hand side, Thailand have National Health Security Office. They spend about 48 million people in Thailand, include healthcare service. They provide the so-called chronic kidney failure budget, about 9.5 billion baht in 2019. To do that, they need to spend not only reagent, but also the automated devices to do the kidney failure treatment. You could see from this slide that we spend a lot of money both to import product and for the health of Thai people. Now, this one is probably the most important one on the 5 strategies. Number 1, as I mentioned, we need to identify the target device. Number 2, the funding of research in collaboration with private company should produce the target product with approved standard and quality. This is very important when you do medical device. Safety is number 1. And then number 3 is sandbox. Number 5, go into innovation list. You could see from the picture there, or from the left-hand side, we use the word reverse engineering. Reverse engineering might mean that researchers should study the existing product, the target product, and they should be able to reverse knowledge or engineering doesn't mean that we copy it. Everyone do it. Everyone has been doing it. Japan, Korea, Taiwan, China. If you want to produce something fantastic and cannot sell, that's not worth spending the money. And you could see the word technology localization. This is what we would like to welcome researcher or company from outside Thailand to join with our local researcher and do this innovation. Currently, we are working on the knee joint implant with Japan and Taiwan, and also on stent for heart ballooning. And once we do that, we need to comply with the standard of safety, both in engineering safety and also in medical safety. And then we go into sandbox. Sandbox, I have practices. Once you produce, after have the standard, local users are not confident in Thai product. So you need to provide certain amount of these already approved devices, certain amount for them to use it and get feedback from them. Once that's approved, it goes into government procurement via the Thai innovation list. Thai innovation list, since 2015, the government has approved the so-called Thai innovative list. The products that listed in this list, it has to be innovated locally, pass the national and international safety standards, and approve competitive price. Government agencies are able to purchase these listed products directly on a special method. They don't have to go through bidding. The minimum, say, certain product, they can buy minimum 30% or can buy more than that. And at the bottom, I show you during the past 5 years, there have been nearly 400 lists of products, and among them, about 58% are medical devices. And then promotion from the government or incentive. Anyone who do R&D and manufacturing will get a privilege from Board of Investment. And also, I don't know, you probably have heard in the lounge outside, there are areas that we show the Eastern Economic Corridor of Innovation, EECI, where there are Aripolis, Biopolis. Both of these are involved with R&D and production and testing of medical device. Also, we would like to welcome our partner from outside Thailand to join us. And Customs Department also working on how to reduce the import tariff of parts from 30% to 0%. Now, this is the BOI, example of BOI privilege. You can see the top one, the A1. If you do a lot of research, then you get 8 years without ceiling on corporate income tax, meaning you can get corporate income exemption more than your financial investment. And you also get the exemption of import duty. And then A2, also 8 years, but with some ceiling on it, and so on. Now, EECI, you can see detail from outside this room. As I mentioned, currently Mahidol University have been working on on how to develop the master plan. And on the right-hand side, you can see lists of products that we would like to promote. And now we are also talking to Customs Department that we should reduce parts that you see on the screen here. You could see electrical transformer, static converter. These ones are used for other purpose, but they are used for as part of medical device also. We would like to encourage or request Customs Department to reduce it to 0% to reduce the cost of production of medical equipment. Now, number 4, strategy number 4 is also important. How do we inform the SME about to do the medical device research, and also on training, on standard, on personal data protection, on cyber security. And number 5, this one is from my own experience. If we want to win, you have to work in cluster. Or currently, we used to use the word platform or partnership. For example, you produce CT scanner for medical devices, for dental treatment. Then you need to work with private company who produce dental implant also. And if you produce 2-dimension X-ray, you need to work with manufacturer of plate and screw also. Now, this is the example that we have worked on digital dentistry platform. Now, I like to show this slide. It probably reflects our collaboration with our neighboring country. This is the kindness of Her Royal Highness Princess Mahachakri Sirinthorn. She chaired the International Convention on Rehabilitation Engineering and Active Technology called iCreate. And you could see the members, Thailand, Malaysia, China, Taiwan, and so on. And on the bottom pictures, there are students who won the competition and went on to produce product in the market. And this is what we would like to invite all our partners from ASEAN to join us. And this is the last slide. I like to show that whatever you do research, it doesn't mean that you can sell your research result. You need to look into the picture called the Valley of Death. So we need a strategy to overcome this. And I like to promote the 3 lines at the bottom. As a question to you, can ASEAN be the world-based wellness and medical service hub? Can ASEAN be one of the world's top medical device manufacturing hub? And last one, can ASEAN be the Silicon Valley of medical device innovation? Thank you. That's the end of my presentation. Thank you for your kind attention. Thank you.